Hello, I am Phil Owen with Communities for Recovery. I'm with the Targeted Response Team, and today my guests from Integral Care are Marlene Buchanan and Jessica Sharib. And Jessica is with the COPSD program. Can you introduce yourself and tell us about your department at Integral Care?
Absolutely. I'm Jessica Sharib. I'm an LPC. I'm a program manager with Integral Care. I oversee our Oak Springs program. So that constitutes our IOP, our SOP, and our COPSD program.
Okay. Can you tell us what COPSD is?
Sure. COPSD is co-occurring psychiatric and substance use disorder case management. It's typically field-based. We work in conjunction with, we can either work in addition, like as a supplemental service to other case management programs, or as a standalone, depending on what the client and or his or her treatment team agrees with. But we do a lot of field visits. We visit people in their homes. We can take them to meetings. We can provide support in the community in general.
Great. Can you explain to the audience what co-occurring might mean?
Sure. For us, it typically means psychiatric and substance use disorders.
Okay. So if somebody was to be experiencing both mental health issues and a substance use issue, that would be a good candidate for the COPSD program?
Yes.
Okay. And how might somebody typically get into the COPSD program or apply for services there?
They could reach out to us at oakspringsreferrals at integralcare.com. I can send you that email address if you want to share it. They can email myself, jessica.sharib at integralcare.com, or they can call Integral Care's main line and they would forward us the helpline.
And I'm guessing in a normal climate, normal meaning pre-COVID landscape, I'm assuming that there probably could have walked in at some point. Would walk-ins?
So our actual COPSD case managers are typically in the field. So they could walk in and touch base with our admin staff and get linked up with a case manager at a future date. But it's more prudent just to call or email because they wouldn't see a COPSD case manager like on site.
Gotcha. Okay, great. Well, that kind of leads me into my next question, which is, obviously we're living in a whole new world at the moment. And I'm very curious to find out how Integral Care, and specifically question for you is how is COPSD or the IOP, what are the challenges and barriers that you've seen with the current landscape?
Sure. So obviously, Integral Care is trying to follow CDC and Austin Public Health Department guidelines as closely as possible. We have the health and well-being of our clients as well as our staff at the forefront of our minds. But at the same time, it's really important for us to continue to be able to provide services and support people during like a uniquely challenging time. So COPSD, IOP, and SOP have all transitioned to exclusively telephonic work for the most part. For IOP and SOP, we identified that it just felt very irresponsible to be offering groups during a community transmission setting. So we have secure conference lines that all of our clients are given. And then we are still running all of our groups at the same times and schedules as they had previously been offered. Clients are provided the conference line and then they all call in and we just do the group through that. COPSD is less so through a conference line. They're just communicating with the case manager, but she's reaching out to them regularly, telephonically, and helping them link up with other services through telephonic work.
Okay, great. Well, what else would you like to tell us about the goings on that we're experiencing right now? How are you guys dealing with it as a staff? Has it been challenging, or I'm assuming you're working from home now?
Yeah, we're all pretty much working from home in our department. So, I mean, of course, it's challenging. I think this is a unique time to be alive, and it's posing challenges for everyone in every sector of the universe, right? So our staff are managing in terms of what we do staff-wise to help manage some of that stress. Is we really have put a lot of emphasis on remaining as a team. So we meet telephonically as a team every single day to talk about what's going on and collaborate about like what sort of bumps we're hitting or how to best work through that, as well as to just be a support system for one another. In terms of clients, we have essentially lifted a lot of our historically IOP has a certain amount of rigidity to it in terms of like attendance requirements or lateness requirements. We've loosened a lot of that so that we can just be a support for our clients right now. We're increasing like our reach outs for folks on an individual basis. What has been really nice coming out of this is some individuals who may have historically kind of had a little bit of a harder time adapting to group have actually identified that it's been hugely helpful for them to have this every day. You know, we offer it for clients, 10 group 4 days a week. So we're hearing a lot of feedback from clients that that group, like that steadiness of knowing that they have to go into every
At Communities for Recovery, we're experiencing that too. So the next thing I wanted to ask was kind of, and Marlene, feel free to chime in on this one too, but is what do you guys envision? We're not going to hold you to it, but what do you envision? What do you kind of expect to come out of this? You know, are we going to see a hybrid system? Or do you expect it to be any different when we come back out of this situation?
So I would expect to see a hybrid. We've learned a lot. We've learned more of how to be technologically friendly. And so we will continue to do in-person group settings and in-person visits, just that face-to-face for some of our folks that don't always get face-to-face. I think there's some value in that, but we've learned how to do more check-ins telephonically. And so anything we can do to reach out to people telephonically, I think we'll incorporate that in the future.
Yeah, for us, certainly something like running groups from the clinical side of it, running groups telephonically poses like a whole new frontier in terms of how to manage that dynamic that there wasn't really like a reference guide for. And I think we've gotten really good at it and we've gotten a lot more comfortable with it. So I think at the very least, we are positioned to be a lot more flexible in how we provide services come what may.
I totally agree. I think that it kind of forced us to get comfortable with services like this. And, you know, the potential is a lot less fossil fuel being used, a lot less bus passes. And you know, I think we need to take the best of it and work with it. And I totally agree with you guys. And that's kind of what we're experiencing at Communities for Recovery. So I've got one last thing to ask you, and that is, if you could create a flavor of ice cream, your own unique flavor, what would it be?
So I'm not inventive enough to come up with my own unique flavor of ice cream.
Then what is your
favorite? I will
favorite?
say that my most favorite flavor of ice cream is a limited edition Ben & Jerry's ice cream that they took off the market ages ago, and I would bring that back. And it's coconut fudge almond chip.
There you go. Awesome. Marlene?
Well, I think I would create one. I'm not very creative either, but I would take all my favorites. So I would take some Heath Bar, some brownie, some espresso, some coffee flavors, and kind of mix them all together. Ben & Jerry's has all kinds of fun stuff. They probably already have that, but I would do a little swirl, a little blizzard, Dairy Queen style.
Awesome.
That sounds delicious. I would have some of yours.
Awesome. Well, thank you guys for being on. If you don't mind real quick, can you leave your website address with the audience and so they know how to look up Integral Care?
Sure. It's www.integralcare.org, and our helpline is 512-472-HELP, HELP. I also want to say that we're still open for business for outpatient services for psychiatric needs. Our East 2nd Street we've consolidated some clinics into our East 2nd Street location, and that's still open for business. The best way to get an appointment is to call the 472-HELP number. Our psychiatric emergency services are also still seeing people same day for psychiatric emergencies.
Okay.
The best way to get an appointment there is also to call the 472-HELP number.
Okay. 512-472-HELP, 472-HELP to get services at Integral Care and make an appointment. Thank you guys so much for being on. I'm Phil Owen with Communities for Recovery and the Targeted Response Team. Thank you so much.
Thank you, Phil.
Thanks, Phil.